to the Hormone Café. I'm Dr. Sarah Pederson. I am an OBGYN and I specialize in holistic health and fertility. Today, we're going to be talking about egg quality. Specifically, how do we measure egg quality, and is there anything that we can do about our egg quality? Because I heard that women were born with all the eggs that they're ever going to have and that there's nothing you can do about your egg quality, which is not true, as we're going to find out. So one thing that we want to know and delve a little bit deeper into is, how do you actually measure your egg quality? Like, how good are my eggs? How do I know if I have good eggs? There's three things that we tend to use as markers of egg quality. The first is called an antral follicle count. We can go and do an ultrasound where I look at your ovaries, and technically the definition is that if you measure your follicles, so you're developing eggs, any follicle that's between 2 and 10 millimeters is something called an antral follicle, meaning a follicle that your ovaries are holding on to ovulate for future cycles. In a perfect world, we want to have an antral follicle count of around 10. And everything that we do in fertility and women's health world is what I call a Goldilocks number, meaning more is not always better. You don't want to have too high or too low. For example, if you have too high of an antral follicle count, that can be associated with PCOS, meaning your ovaries are enlarged and that your hormones are imbalanced, because if your ovaries are enlarged, you have too many antral follicles, that can make your body have a harder time producing hormones in proper amounts in order to recruit eggs to ovulate. So we want to have around an antral follicle count of 10 little follicles ready to be growing per ovary. And if we have a lower antral follicle count, that can be associated or be a proxy for a lower egg quality. The second thing that we use to check egg quality is a blood test, and that's something called an AMH, or Anti-Müllerian Hormone. Also a Goldilocks number. We shoot for having an AMH of around 2 or 3. You don't want it to be a lot higher, because that means that your body has to work really, really hard in order to ovulate. Sometimes patients have an anti-Müllerian hormone of 10, and I hear their doctors say, oh, you're so lucky, you have a great egg quality, your eggs are amazing. But when I see that, it's actually a really bad sign, because when you have to recruit 10 follicles in order to get one to ovulate, instead of just recruiting a couple follicles that cycle, that means that your body has to try really, really hard to ovulate and can be just constantly stressed out. And you can feel this as just having a lot of fatigue all the time. And that actually is related to your body working so hard in order to ovulate, which shows up as a high AMH, or anti-Müllerian hormone, on your blood. On the other side, if we have a low AMH or a low egg quality, that also can be associated with having a higher chance of having miscarriage, a little bit harder time ovulating. So that's how we can measure kind of a little bit of a proxy for your egg quality, is something called your AMH, or your anti-Müllerian hormone. This is a blood test that we can do anytime in your cycle. It doesn't matter where you are in the cycle. And then the last thing is that we test often cycle day 3 blood work. So that blood work that we test, called FSH and LH, those are your brain hormones. Those are actually made in your pituitary. We want your FSH and LH to be the same number and be really balanced, and to be less than 10. So if your FSH and LH are creeping up to 10 or higher, that also means that your brain has to work really, really, really hard in order to ovulate. And if your brain's working hard to ovulate, that can be because you have a lower egg quality. So low egg quality can be associated with having high FSH or LH, a low AMH, or a low antral follicle count. Okay, so you come in, we measure your egg quality, let's say it's low. What can you do about it? Because the traditional teaching is, oh, you're born with all the eggs you're ever going to have. There's nothing you can do about your egg quality. Totally false. We can definitely work and do a lot of different things to improve egg quality. As with everything I do, the basic foundation of it all is nutrition. So we think about, okay, how do we improve egg quality? It starts with nutrition, then supplements, then medication, then surgery. So when we think about our egg quality, the number one things that you need to be eating are antioxidant foods. Vegetables have to be your new best friend. I recommend that you have at least 3 to 6 vegetables per day. So in a perfect world, we'd be eating 2 vegetables for breakfast, 2 vegetables for lunch, 2 vegetables for dinner. The highest bang for your buck is greens. So Brussels sprouts, asparagus, broccoli, kale, spinach. The more green vegetables you have, the more antioxidants you're getting. And just as a little side, there's no cheating. For example, you really want to be eating whole vegetables. They can be cut, they can be baked, they can be chopped, but they cannot be juiced and they cannot be blended. Why? The reason is because the most nutrients contained in a vegetable are in the fibrous mesh. And vegetables actually have some carbohydrates. They have some sugar. They're about this much nutrients and fiber and this much carbohydrates. So for juicing our vegetables, we're just getting rid of all the nutrients, getting rid of all the fibrous mess, and just concentrating the carbohydrates and just drinking sugar. So when you juice your vegetables, it doesn't count as having a vegetable. Same thing with blending. You really don't want to blend your vegetables into a smoothie. Why? Because now we've just blended out the entire fibrous mesh and concentrated the sugar. So when we think about vegetables, you have to eat your vegetables whole in their whole selves. Again, they can be cooked, they just can't be blended or chopped or powdered. Please don't substitute a powder for actually eating vegetables. If you come to me and you say, Sarah, I literally am not going to eat any vegetables at all, okay, then it's better to blend them, put them in a smoothie, have a powder that do absolutely nothing. But in a perfect world, ideally, we'd be eating vegetables. That vegetables does not have to be a huge volume. Sometimes I reach into my fridge, I grab 3 leaves of spinach, I pop them into my mouth, boom, there's one of my 6 vegetables a day. Because it can be really overwhelming to think, oh my gosh, I'm gonna have to eat 6 kale salads a day. My eyeballs are gonna be floating in kale salad. You just wanna get in the variety. The variety is important because the vegetables just pack a huge punch when it comes to antioxidants. And antioxidants are what improves our egg quality. So we want to be doing lots of greens, at least 6 vegetables a day. And if you're like, I'm so tired of vegetables, how do I get other antioxidants? My favorite ways are berries have a lot of antioxidants. So things like blueberries, raspberries, blackberries can also pack a huge punch when it comes to antioxidants. The other favorite thing is tea. Green tea has a lot of antioxidants and green tea is lovely. One thing I'll say about tea is that sometimes when we think about tea, we want to add something to it like sugar, honey. Please just make sure if you're drinking green tea that you have it very basic. You can just have green tea. Don't add any sweetener to it. Just have really savory, earthy green tea. Same thing when you order green tea somewhere or you buy a green tea powder, make sure it's very pure. Just matcha and just green tea, because a lot of things like matcha powder and other green teas, they can have a lot of sugar in them, unfortunately. So when you're doing green tea, just make sure it's really pure. It can be helpful, and I know this might sound a little bit sacrilegious, but even to substitute some of your coffee for green tea, because the antioxidants in green tea have a lot of benefits for our egg quality. Other things that really help our egg quality are turmeric, for example. Turmeric is a lovely antioxidant. So turmeric, green tea, vegetables, berries, great way to get antioxidants. The second thing that we need to be doing is moving our body, because blood flow to your ovaries is very important for your health. We don't want to be doing nothing. We want to make sure that we're doing a little bit of cardio, ideally at least 15 minutes, 3 times a week, because we want to get our blood flow moving in a way that we can always optimize blood flow to our ovaries. So those are really important lifestyle things that we want to be doing to keep our eggs as healthy as possible. The next kind of tier that we want to think about with regards to egg quality is supplements. That's kind of a tricky one. There's 10,000 gazillion egg quality supplements out there. But just to overview some of my favorites, I really base people's supplement recommendations on how good or bad their egg quality is. One of my philosophies with supplements is I don't want you to be taking a gazillion supplements for no reason. For example, if your egg quality is really good, you don't have to take a bunch of supplements to improve your egg quality. You only want to take supplements to fill in gaps or to work toward very specific goals that we're working on. So let's say your egg quality is really not great. I usually try to have you take about 3 egg quality supplements. Again, more is not always better because ideally we would get them from food. We never want to have a supplement as a band-aid for something that we should be doing from a diet perspective. However, it is helpful to get a lot of different antioxidants. The only thing that I get a little worried about with supplements is sometimes you can have supplement fatigue. You're just taking a ton of pills. And another thing is that supplements are entirely basic, right? They have a filler, they have a capsule. So you don't want to be taking so many supplements that now you're having a ton of microcrystalline cellulose and sunflower lecithin, and it's clogging up your liver, and it's actually having a negative effect. So we want to be able to take just enough supplements to actually help us without going overboard and taking too many and overwhelming our bodies with digesting all of those pills. That's why it's not a hard and fast rule, but I try to stick with having 3 antioxidant supplements for people that have really low egg quality. So this is obviously dependent on everybody's situation, but some of my favorites are CoQ10. There's a CoQ10 that's a little bit more of a pure form called ubiquinol. So I use a lot of CoQ10. Myo-inositol is a supplement that can be helpful for egg quality. Melatonin can be helpful. Also melatonin, you have to be careful. We got to use that one sparingly because in a perfect world, we would actually help support our body's natural melatonin production. But for short periods of time, that can be helpful. Resveratrol can also be a helpful antioxidant. And then NAC, or N-acetylcysteine, which is a precursor to glutathione. Glutathione is a very powerful antioxidant. So both of those things can be helpful. And then things like alpha-lipoic acid. So in general, our family of antioxidant supplements can be really helpful to help our egg quality on top of what we're already doing with our lifestyle, diet, and moving our bodies. Then the next tier that we think of, okay, I'm maxing out, I'm doing everything I can, eating tons of vegetables, just like Dr. P said, taking all my supplements. What are the next tiers that we can do to help with egg quality? I think of those in different categories, but just some of the medications that we can use to help egg quality. One is testosterone. And sometimes that sounds a little bit strange, like, oh, you're going to put a woman on testosterone? That's bizarre. However, women do need testosterone. We just need it in way smaller amounts than men. The important thing about testosterone is testosterone helps our energy levels, it helps us heal, and it helps support a developing follicle. So when we're in the beginning stages of ovulation, it helps make our follicle nice and strong. So there's good data to suggest that if our testosterone levels are in good ranges, we can have nice, healthy, strong follicles. So testosterone is something that I'll sometimes put people on, especially if you have low testosterone, to try to help egg quality. Another one is steroids. So I do a lot of different steroid protocols because there's some data that shows that steroids can help with egg quality. And then another example is growth hormone. Sometimes we measure growth hormone and see if anyone's growth hormone is low, because if so, they can be a candidate for being on a growth hormone protocol because growth hormone grows. So it can help us improve some of our egg quality. So lots of different more advanced protocols that I do for different phases or stages of where people are and what we want to be working on as a goal for our egg quality. And then the last thing is surgery. I do something called intra-ovarian PRP injections, and PRP stands for platelet-rich plasma. We actually stole the technology from orthopedics and dermatology. A lot of times people are familiar with PRP because they've heard of or had somebody get a joint injection. So in orthopedics, they'll take PRP and put them into our joints to see if we can heal your joints and try to prevent you from having surgery. And then in dermatology, sometimes people will inject PRP as a facial, so I can give your ovaries a little facial. And what I do is we draw your blood and then we spin it down to just the healing cells or the platelets. Platelets are healing cells that go to an injured or damaged area of your body and help it rejuvenate and help it heal. So what I do is I take that blood from you, we spin it down to that PRP or platelet-rich plasma, and I can inject it directly into your ovaries. And I've had amazing results and had people quadruple their AMHs or their egg quality. I've had people in menopause and perimenopause become pregnant because those rejuvenating cells to really help your ovaries and your egg quality. So those are all the different tiers and all the kinds of things that we think about when we think about what are all the things that we can do to improve our egg quality. And if you have been diagnosed with a low egg quality, please do not give up on your body. There's lots of things that we can do. Trust in your body and trust that it knows what it's doing. Sometimes it just needs a little bit more support. But yes, you have all the eggs that you were ever born with. However, your whole body has that, right? Like you have the brain that you were born with. You have the kidneys you were born with. You have the liver you were born with. You have the uterus you were born with. That does not mean that it's just going to degrade over time and there's nothing we can do. No, there's absolutely lots of things you can do to keep all your other organs healthy, right? Like keep your brain healthy, keep your liver healthy, keep your heart healthy. Like, yes, you were born with this heart, but that doesn't mean you're not going to be able to keep it healthy. Ovaries and eggs are the exact same way. Because some people, they say, oh, now that I finally, started taking care of my body, I feel way better at 50 than I even did at 40, or I feel better at 30 than I even did at 20. We can make our bodies feel better and feel amazing every single day. So thank you for joining me today on this episode of the Hormone Café. Next time, we are going to talk about a co-topic to egg quality, which is sperm quality. So as much as we focus on egg quality, guys, you are not out of the woods. We need to focus on your sperm quality as well. So if you want to ever test your egg quality, know where you are in the egg quality spectrum, talk about some lifestyle things that we can do in order to promote your egg quality, talk about medicine, surgery, please come visit me. You can make an appointment at verafertility.com. And we can do everything we possibly can to give you the healthiest, happiest ovaries that we can.